Welcome to this presentation discussing lumbopelvic stabilization therapy for the treatment of lower back pain and a novel new treatment device called the Core Laser by LaserGym. Presenting today is Doug Meyrose. Doug is a practicing physical therapist in Scottsdale, Arizona at the Foothills Sports Medicine Physical Therapy Centers. He earned his doctorate in physical therapy at St. Louis University in Missouri. Welcome, Doug.
Hello, and welcome to our webinar. Today I will be discussing the following topics: a brief background on lumbopelvic stability and lower back pain. I will explore treatment plans and the incorporation of neuromuscular reeducation, as well as popular current treatment modalities. Following the background information, I am going to introduce you to a new treatment device called the Core Laser by LaserGym. We will examine the principles driving the efficacy of the device and the clinical application of the new modality. To wrap things up, I'll come full circle to address how the Core Laser fits into our practice as a treatment option for lumbopelvic stabilization and lower back pain. Dr. Hodges, the pioneer of lumbopelvic stabilization, wrote, "Accurate control of the lumbar spine and pelvis is dependent not only on the capacity of the muscles, but also the sensory system that provides information about the status of stability, recognition of perturbation, and the development of the internal model of body dynamics that provides the CNS with the capacity to predict the outcome of a mechanical event and predict the interaction between the body segment and the environment." With age or injury, patients tend to lose control of the intrinsic stabilizing muscles of the lumbopelvic region, resulting in insufficient lumbopelvic control. One compensatory mechanism for the lost stability is to recruit and contract the extrinsic muscles of the region, thus resulting in the stiffening effect. The stiffening and subsequent fatigue of these extrinsic muscles can precipitate what patients experience as chronic lower back pain. Per Dr. Hodges, a treatment plan for low back pain should strengthen all the muscles of the lumbopelvic region while simultaneously re-educating the body on how to control these muscles. Practically speaking, as clinicians treating low back pain, we should use modalities that activate the muscles of the lumbopelvic region and incorporate biofeedback to ensure neuromuscular re-education. The Core Laser can be a wonderful asset to utilize in conjunction with other practice techniques. As a quick review, neuromuscular reeducation includes triggering the sensory system comprised of visual, vestibular, and somatosensory biofeedback. As a note, numerous studies have indicated that visual biofeedback is the most reliable of the sensory systems and that it is more likely to suppress inappropriate neuromuscular responses, and lack of visual feedback has the most detrimental effect on kinesthetic awareness. Here are some commonly used lumbopelvic stability modalities used in the clinic: supine pelvic tilts and clocks, Swiss ball exercises, wobble boards, and Kegel exercises. As noted, all these modalities activate the appropriate muscles. However, as standalone entities, they lack the added biofeedback valuable in establishing neuromuscular reeducation. A new device has recently entered the market called the Core Laser by LaserGym. The Core Laser Pro is a revolutionary lumbopelvic stabilization and proprioceptive device that uses the beam of a laser to guide a patient through a series of dynamic pelvic exercises while providing constant, easy-to-interpret biofeedback. The following video provides an explanation of what the Core Laser entails.
The Core Laser Pro is a laser-guided therapeutic training system specifically designed to target the center of the human body. It uses LaserGym's newly patented direct visual feedback training to provide the user with an external visual cue or guiding light for body movement. Have the patient stand and face the target. We recommend you start 5 feet from the target. The patient then uses the beam of the laser to trace the lines and patterns of the target. Distance from the target will vary depending on the patient's flexibility and strength. Tracing these patterns provide a dynamic strengthening workout for the core, specifically the stabilizing muscles of the spine, which include the transverse abdominis, lumbar multifidi, and pelvic floor muscles. It also increases range of motion, stability, balance, and proprioception in the core region. The core laser is a fantastic teaching tool as it utilizes instant visual feedback to aid in the instruction of various pelvic exercises, ranging from simple pelvic tilts to more functionally dynamic movements. The core laser is a great treatment modality for patients who suffer with lower back pain, as it addresses the key issues often associated with back pain, which include weak muscles, limited functional mobility, and lack of exercise.
The core laser is the only device that addresses both the muscle capacity as well as neuromuscular re-education components for treating low back pain. The core laser is a valuable, reimbursable treatment option to be classified as neuromuscular re-education or therapeutic exercise as determined by the capacity in which you use the core laser. In my experience, I have found the core laser most beneficial documented as neuromuscular re-education. In summation, chronic low back pain is highly correlated to weak lumbopelvic muscles. Treatment for low back pain can be enhanced by targeting the muscles while addressing the proprioceptive component through biofeedback therapy. The core laser provides us with a great tool in our treatment options that both targets the appropriate muscles while providing the patient with instant, easy to interpret visual biofeedback all in one device. I thank you and I appreciate your time viewing this webinar, and I hope you enjoy using Core Laser by Laser Gym as much as I have.